base on the economic benefits of Endotool from the reduced cost of care. We've touched base on the enhancement of nursing workflow. Now I'd like to transition to overall patient safety and go to you, Melissa, from VCU Health. And I know, Melissa, you've used Endotool for quite a few years in just one nursing unit, the cardiac ICU, and you've had phenomenal results there. How did you make the case for expansion across your system?
So the case that we chose to make with our leadership when we were trying to get the go-ahead to expand Endotool beyond just our CSICU was primarily based on patient safety. I'm the medical director for medication safety, so thankfully most of my job is not related to contracts and other assorted financial issues, but primarily related to making sure that our patients get the care that they need in the safest way possible. And so after seeing the standardization that we could get within the CSICU and seeing those amazing numbers that everyone else has already talked about with improvement in hypoglycemia management and reduction in the amount of time within elevated blood glucose ranges, we were able to talk to our leadership about making sure that every patient that we have gets the same standard of care across the institution. We've recently acquired 2 rural hospitals to add to our academic medical center that is an urban center. And so wanting to make sure that our patients at those 2 rural centers got the same standard of care that our folks at our academic medical center with access to more consultants would get. And so the other thing that we wanted to talk about was variability. As was mentioned a little bit earlier, we do have a lot of new grads that enter our system fairly frequently, whether it's a new grad nurse or someone who's just graduated from medical school and starting as a brand new intern. We have, since we're an academic medical center and we have a medical school, we also have an extensive residency program with a lot of residents across the spectrum. We have medicine, we have surgery, we have emergency medicine, and so a lot of different exposure to different perspectives, and having that ability to make sure that everybody treats DKA the same way every time a patient comes into the hospital is really helpful. Same thing for HHS and hyperglycemia. So that was the big reason for our request to expand beyond just the CSICU. We've had Endotool there for almost 10 years now, and much like some of the other talks about what would happen if we took it away, the CSICU nurses are very good proponents of using Endotool. And when we have some of our other ICU nurses that float into the CSICU, they are really excited about using the tool. It usually only takes about 10 to 15 minutes to get those nurses up to speed on Endotool, since they don't use it in their usual ICUs. And then they will typically ask, why can't we use this in my unit? And so that's one of the things that we are working on right now, is getting that rolled out, and hopefully by the beginning of calendar year 2026, we will have everything all set up across our 3 health system hospitals to make sure that everybody's getting the same standard of care regardless of their entry point into our health system.
And with that same standard of care, you're going to have better outcomes and lower cost of care. How about with the upcoming CMS requirements that beginning in 2026, all hospitals are going to be required to report through the electronic clinical quality measures, severe hypoglycemia and severe hyperglycemia. Was that a factor at all in the decision, or did you make the case with that as you were talking to senior leadership?
I'm glad you mentioned that. When we started on this journey, one of our chief quality and safety officers at the time mentioned that that was coming down the road and would be something that we would need to look at. And we'd started building a bunch of metrics within our EMR, trying to make sure that we had a really good way to monitor our hypoglycemia and hyperglycemia. And one of the things that was really helpful was having those quarterly meetings with our Endotool representative, our customer success representative, who would go through those metrics over and over again with us and kind of explaining how we fit in amongst other clients and how we kind of compared to some of those nationally expected data as well. So I don't know that that really factored into anyone's decision per se, but I think it was something that some of our financial folks were kind of keeping in the back of their minds when they thought about this decision, because it obviously has some implications coming down the road for our reimbursement. And that's obviously at the top of the mind for a lot of the folks in our C-suite, just making sure that we're keeping that bottom line.
Yeah, and it's a combination of how it affects reimbursement, and is also how your institution looks to the public, because they can see these rankings on online for sure.